Hello, my name is Phyllis Zimmer. I'm a nurse and a nurse practitioner, and I'm the president of the Nurse Practitioner Healthcare Foundation in the United States. I'm also a member of the Connecting Nurses Steering Committee. Connecting Nurses was set up in 2012 through the collaboration of several international nursing organizations with the financial support of Sanofi. The aim of Connecting Nurses is to share best professional practice with nurses around the world. Today, it's my pleasure to introduce you to a series of short video vignettes entitled Talking with Patients About Self-Injection. These videos are designed to help nurses working with patients who are learning to inject their own medication. As you know from your own experience, patients often find the idea of injections, and particularly self-injection, daunting. Although some patients do have a fear of needles, which obviously has an impact on their ability to self-inject, in a small focus group conducted by Connecting Nurses, we found that patients' number one worry was their concern about making mistakes and not injecting correctly, not about fear of needles. Medical literature shows that feelings of embarrassment or stigmatization can also cause important psychological barriers. As nurses, we have a major role to play in educating and supporting our patients so that they can self-inject with confidence. We need to ensure that they understand the practical steps for self-injection and that they keep their motivation levels high. If we fail to educate, support, and motivate our patients, there's a risk that patients won't adhere properly to their treatment or may even give up on self-injection completely. In these 5 educational videos, we show how to handle some common but often difficult situations with patients who are in the process of coming to terms with one or several chronic illnesses and the lifelong prospect of self-injection. No one specific illness is mentioned because these conversations can take place with any patient who is learning to self-inject, regardless of the particular disease being treated. The video clips follow a patient's journey from diagnosis to long-term adherence. But do feel free to dip in and out and view the clips that are most relevant for you and your practice. The nurse-patient interviews we present here are structured around spikes, a communication framework that was originally developed to help physicians deliver bad news to cancer patients. Connecting Nurses has adapted the 6 steps of spikes for nurses to use in the context of self-injection. We believe the E for empathy is particularly relevant to nursing because this element should be present in every conversation we have with our patients. It includes our listening skills and also our ability to reflect back to patients the feelings that they're expressing. Nurses do this really well. In addition to these video clips, we've produced a simple tip sheet to help you talk with patients who are worried or upset. A self-injection information card has also been developed for patients to use. Both the tip sheet and the information card can be downloaded for free from the Connecting Nurses website at www.connecting-nurses.com. Success in treatment and long-term adherence are all about the relationship we build with our patients. I couldn't have imagined introducing this topic without Robin Noble, the patient who kindly supported us in this project.
Thank you, Phyllis. The videos we are going to share with you represent several critical moments that self-injecting patients come across. Every patient is different, of course, but the exchange and the support we get from nurses and other healthcare professionals is absolutely crucial to our success. Mutual listening does affect how we handle our condition and how we feel. At times, it feels daunting and embarrassing to bring up these topics, but it is key for patients to understand it's all right to have those conversations. It is, in fact, very useful to have them.
So now, we would like to invite you to sit back and watch some or all of our video vignettes.